Ladies and gentlemen, welcome back. This is the Captain's Quarters Show. I am your host, El Milliner, the Captain. Thank you all for hopping aboard with the Captain. Today, I have a video, an interview from the newly appointed CDC Director, Mandy Cohen. Now, she was just recently appointed by President Joe Biden. What happened to the old CDC Director, Michelle Walensky? I do not know, but here we are. Looks like same dance, different song, but I have the interview that she did with Time, and I'm gonna play that, and let's see what she's talking about. Thanks again for joining.
One of the issues I think that people are grappling with right now, and the agency is a mistrust in science in general, but I think in the CDC in particular.
I don't think the mistrust is in science, because science just is science, right? So when you do science the right way, you go off of the data that you collect as a result of that. I think what we saw happen, especially in reference to the 2020 shutdowns and everything, we saw science be manipulated and used to tell people to act in a certain way based on science, but it really wasn't science. It was just a bunch of opinion. So the issue is not with science. The CDC had the issue with not using science. That's what the issue was.
I'd love to get your perspective on that perspective, both coming from the outside as secretary in North Carolina, and now that you're director, how you plan to address that.
Well, first, I think trust is absolutely foundational. I think change happens at the pace of trust. And so it underlies everything that we do. And I will say, as Health and Human Services Secretary for North Carolina, we called out and named trust as central to how we responded to the COVID crisis. We thought about it every day, and we measured it, importantly. And what we saw over the course of leading through that crisis, we saw trust actually increase in the department that I ran.
Okay. So we know that she came from North Carolina. She was the health secretary there. And so what they're not going to get into in this interview, but I do know is that she was she worked alongside the Obama administration. So she was the chief operating officer at the Centers for Medicare and Medicaid Services, and they helped roll out the Affordable Care Act, right? Or people know it as Obamacare. So she's been tied in with Obama, VP Biden. Remember, he was the VP for Obama. Now he's the president. So there's that connection. So anyway, just trying to, connect some dots for you guys. Now let's fast forward to in this conversation.
How concerned are you about the increase in hospitalizations from COVID? Because, since we're not tracking cases so much anymore, hospitalizations is like a good lift.
Yeah, so right here's where she's going to bring in a lot of the measures, the guidelines that were utilized during the whole shutdown era. And she's going to basically just kind of just puppet those same things to us. So let's watch and listen.
Litmus tests for, like severe cases or people getting sicker from their infections. How concerned are you about that trend?
So we are seeing hospitalizations go up. We're here in August of 2023, and it's reminding us that we are living with COVID, right? It is not gone, and it means we need to continue to avail ourselves of the tools that protect us. Vaccines, testing, and treatment. Luckily, we have more tools than ever before going into these next seasons, and we're going to have a new booster that comes out in the middle of September. So we have the tools, we just need to use them. But I'd say about the current level, I'm not concerned right now, but we're going to continue to watch that. If you saw, the highest number of hospitalizations we had last year was about 45,000. We're about 10,000 right now. So we're much lower than we were at a peak last year.
Yeah, so they're basically just kind of putting it out there like, look, COVID hadn't gone away. we're heading to the fall, in the winter, we're going to see it come back, right? So don't be surprised when all those mandates and regulations and guidelines that happened a couple years back come right back, and they push those same things again.
Last year, but we have to keep vigilant and making sure that we're using the tools to protect ourselves. So you're going to hear us talk a lot about vaccines, testing, and treatment. Vaccines are safe and effective. We have great tests that can rapidly identify what you have, and then treatment that works, but you have to use it right away.
Right. So except those what she just said, right, that are safe and effective, it's except in cases where they give you myocarditis, they give you blood clots, who knows, neurological issues. There's people that have had partial paralysis and just many other symptoms of getting what she just said are safe and effective. But they're not going to mention that part. So fast forward to this, because they're going to get into women's rights or whatever. So it gets a little, I don't know, it gets a little odd to me because how she describes it. Let's watch.
To be able to do that, we need to make sure that folks have access to the tools that can keep them healthy at all moments of their life, whether they're thinking about becoming pregnant, during their pregnancy, or even after when they're a young mom. And we have a lot of data.
I'm so glad that she admitted that the people who have children are mothers. They're women. Thank you, ma'am. Thank you so much for putting this out to the public, so that you just solidify that, so that all the numbskulls and the smooth brains now know that when a woman has a baby, she becomes a mom. Wow.
And best practices and evidence that we can bring to bear to show that when we work with moms so that they are getting pregnant when they are ready and want to, meaning that they have access to contraception so they're not getting pregnant if it's not the right time for them and their family, that means babies have better outcomes, as do mom.
And just this week, we've seen
babies have better outcomes, as do mom. Thank you again. Thank you for the mom. I appreciate that. She's being very consistent with the mom. But anyway, what she was saying is, I hear her saying that terminating a pregnancy is not only good for the mother, a good outcome for the mother, but it can be a good outcome for the child. That's what I hear her saying, because she's saying a mother who has a child that she doesn't want will not have the best outcome, right? Because who wants to be born to a mother who doesn't care about the child? You know what I'm saying? But on the flip side, if she terminates the pregnancy, it's a better outcome for the child, because you don't have to worry about being with a mother that didn't want you. That's what I hear her saying without saying it.
Another blow in the form of the appeals court decision, backing the Texas judge's ruling on mifepristone. Mm-hmm. It remains available, but this is going to be debated in the courts. Mm-hmm. How much of an impediment is that? This is something that there is good science behind, and yet.
So apparently this is a birth control medication of some kind that they're talking about.
We're looking, to a whole different system, the legal system, to kind of decide whether women can have access to it or not. As a physician and as, a public health leader, how does that strike you?
Well, I'm so disappointed that we are here, that we are having the conversation to revisit whether or not women should have access to health care when they need it.
Is that what that is? So it's women's health care for them to have the right and the ability, the legal ability to terminate their child, a living being, an innocent life. That's called health care? Okay.
I will say, as both a mom of.
She was doing good with the mom thing. Here she goes with the mom thing again. You're doing very well with the mom. I love the consistency. I was talking about mothers because they're women, but this whole other thing, you're way off, and pretty much everything she's talking about.
Of 2 daughters, a physician, and now the director of the CDC. I'm going to continue to make sure that we are working to make sure women have access to care when they need it, that they have medical treatment when they need, and that's all parts of their life.
All right. So if y'all want to, check that out, I will link that in the description. But same dance, different song. I mean, Michelle Walensky is no more with the CDC. Now we have Mandy Cohen. I mean, what 1A, 1B. I mean, same thing. But that's the video. I appreciate y'all for hopping aboard with the captain. If y'all will, leave me a comment. Let me know what y'all thought about what she's talking about and what I said in relation to what she said. And do y'all think we'll have a different outcome with her being the CDC director? Let me know. If y'all will, share the video. And of course, hit that subscribe. I appreciate y'all. This was the Captain's Quarters show. I was your host, L. Milliner, the captain. Until next time, I am gone.